What is an ectopic pregnancy? An ectopic pregnancy is when a fetus develops outside the uterus. The embryo dies in most cases. The fallopian tube is small enough to support the embryo, but not large enough to give blood. In around 15% of cases, the tube will break. This is a medical emergency that requires surgery and a blood transfusion. If you need an ambulance, call 000. There are cases of ectopic pregnancies in the abdominal and ovarian regions. One ectopic pregnancy can be a medical emergency. Prompt treatment reduces your risk of ectopic pregnancies, increases your chances of healthy pregnancies, and reduces future health problems. A fertilized egg can't grow outside the uterus. The fallopian tube, abdominal cavity, and cervix are affected by an ectopic pregnancy. If you think you are pregnant, you should see your doctor. What causes an ectopic pregnancy? Ectopic pregnancies can be caused by conditions that slow down or block the movement of the egg down your fallopian tube. You have scar tissue from a previous surgery. You were born with a growth that is blocking your fallopian tubes, or you were born with an irregular fallopian tube. Signs and symptoms. The last normal menstrual period can cause ectopic pregnancies. There are a number of symptoms, including vaginal bleeding, increased chorionic gossamer, and lower abdominal pain. Up to 10% of ectopic pregnancies have no symptoms at all. If there is no assessment of the fetus, vaginal bleeding can be a sign of a miscarriage. Nausea, vomiting, and diarrhea are not common. A person with an ectopic pregnancy may experience pain when lying flat. If you have an ectopic pregnancy, your fallopian tube can burst. Emergency symptoms include pain, bleeding, and or both. If you have vaginal bleeding with lightheadedness, you should call your doctor. If you are pregnant with twins, you may have to wait until the second trimester to have a baby. If your baby is not growing normally, you can go to the emergency room. Less than 10% of ectopic pregnancies occur outside of the fallopian tube. Smoking, advanced maternal age, tubal damage, and prior pelvic infections are some of the risk factors associated with ectopic pregnancies. Older age is more likely to cause ectopic pregnancies because of the less function of fallopian tubes. Interstitial ectopic pregnancies have higher mortality rates than other ectopic implantation sites. The high rate of hemorrhage in pregnant women is the reason for increased morbidity and mortality. What are the complications of an ectopic pregnancy? The uterus is the only organ that can hold a baby. The fetus can expand and stretch. The fallopian tubes are not as flexible as you might think. The egg can burst as it develops. It can cause life-threatening internal bleeding. An ectopic pregnancy needs to be treated. Symptoms of a rupture. An ectopic pregnancy can cause the fallopian tube to be split. The surgery is serious and needs to be done as soon as possible. If you feel unwell, have a sudden and intense pain in your tummy, or are very dizzy, you should immediately go to the A department. How is an ectopic pregnancy diagnosed? Most people don't know they are pregnant until they visit their doctor. Your provider will perform tests to diagnose an ectopic pregnancy. Confirmation of a baby's existence is possible. If your provider suspects the ectopic pregnancy has been rupturing, cholestasis is not used. An instrument called an sputum uses sound waves to create a picture. What's the long-term outlook? The long-term outlook after an ectopic pregnancy depends on the baby's health. People who have ectopic pregnancies are more likely to have healthy babies. If the fallopian tubes are intact, the egg can be fertilized. If you have a reproductive problem, it can affect your future fertility and increase your risk of future ectopic pregnancies. Give yourself time to grieve. When you are ready, talk to your doctor about how to keep your baby healthy. You can ask your doctor if there are support groups in the area. Treatment. Stable women with a non-ruptured ectopic pregnancy can benefit from laparoscopic surgery. The decision of which procedure to pursue is based on the patient's clinical picture, laboratory findings, and radiologic images. When patients show signs of bleeding, they need to have a surgical procedure. After an ectopic pregnancy, if you think you are pregnant, be aware of the changes in your body. An ectopic pregnancy can affect your mental health. If you had a fallopian tube removed, you should talk to your doctor about how long you should wait before trying again. Experts suggest giving yourself at least 3 months to heal. It might be difficult to have a normal baby after an ectopic pregnancy. Don't hesitate to reach out to a mental health expert. Increasing age. Women between the ages of 15 and 24 years have a twofold increase in the risk of developing an ectopic pregnancy. The rate of ectopic pregnancies is highest for women 35 to 44 years old. One proposed explanation suggests that aging may result in a progressive loss of myoelectrical activity in the fallopian tube. Heterotopic pregnancy. In rare cases of ectopic pregnancies, there may be 2 fertilized eggs, one outside the uterus and the other inside. The survival rate of the uterus is 70%, and it can still be viable if the levels of the fertility drug, chorionic gonadotrophin, continue to rise. This is usually found through an instrument. It is difficult to detect a pregnant woman who is ectopic. Early screening for ectopic pregnancy is vital. Early screening for ectopic pregnancies is important. Women who are at high risk must be monitored. It is important to tell your doctor if your medical history includes any of the known risk factors. If you have unusual symptoms during your pregnancies, you should see a doctor. Thank you for watching. Do subscribe, like, and share.